Hi, good evening, everyone. Hope you're all doing well today. So, if I'm audible and I'm visible, can you just let me know in the chat box? If there's no problem in the AV, just let me know in the chat box. You can give a thumbs up or something so that I know that there's no problem with the audio visuals. Visible? I'm visible to all, right? I'm not getting any confirmation, so just let me know so that I can proceed. All right. The chat box is not working for me. Okay. Right, so I'm going to, good evening. So I'm going to target, this especially these few classes, specially targeted towards the FMG students who are going to appear in July. And in a series of different YouTube lectures, I will cover the important questions in various sections of pharmacology, right? And so this can help you practice and revise and recall your the importance. So these questions, I be rest assured that these are the questions that you need to know, you must know, because previous year questions you have to get a grasp on them, right? So let's get started right away, and we'll start with general pharma, going to ANS and the autocoils. All right, all right. So keep answering and keep the chat box buzzing with your answers as we go about. So which of the following parameter is used to assess the rate of absorption? Very easy, asked multiple times. So let me know the response. Which of the following parameter is used to assess the rate of absorption? Is it Tmax, Cmax, half-life, or area under the curve? Tmax, Cmax, half-life, or area under the curve? Yes, please. Let's have the answers. Answers. Can't just give me a second. I think the chat box is not moving for me. Just a moment. All right, yeah, now it's good to go. Sorry, I'm back. I wasn't able to see the chat line. All right, thank you so much. I'm so sorry there was some problem with the session. All right, yes, four, no, 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 not four. So all those have answered one are bang on, right? Excellent. So it is Tmax, right? So all those are answered one, they are absolutely, absolutely correct. It is not, see, it is the rate of absorption, how fast the drug is attaining its maximum concentration, how fast the drug is reaching its plasma concentration. So you see this graph here, this is your Cmax, right? Yeah, very good. It is Tmax, excellent. So this is Cmax, this is Tmax, and this is the area under the curve. So Cmax is just tells you the maximum concentration reached, right? And this concentration has reached. So it will tell you the rate. Okay? Rate is always how fast something is being done. So Tmax will tell you the rate of absorption, and area under curve tells you about the extent of absorption. So mind you, this question has been asked time and again. Area under curve is the extent and T max is the rate of absorption. ठीक है, so area under curve and half life has nothing to do with this. Now area under the curve जो भी है, the formula is utilized where? To calculate your bioavailability. To calculate the bioavailability. So area under curve for oral over area under curve for IV multiplied by 100. This tells you about the bioavailability of a drug, right? So this is your bioavailability. So let's quickly even understand what is the formula for half-life. So if you're given a numerical to calculate the half-life, what is the formula for half-life? T half. T half is equal to 0.693 multiplied by volume of distribution over clearance. So that is your half-life formula, right? 0.693, right? Into volume of distribution divided by the clearance. Now I see my video being stuck in my mobile. Am I stuck or is it moving? In my phone actually I see it is stuck. So can you please confirm if everything is fine? Can you see the things moving? Like, just reply, yeah, it is fine or it is stuck, so I know. Because I can't see. It is good? Okay, maybe something is wrong on my device. Fine, alright, let me keep on moving then. So area under curve, oral over IV in into 100, right? Excellent. So this is a diagram which is actually say in the book, which is Tripathi. So again, I just say same thing. This is the rate of absorption. This is the extent of absorption. This is the safety, right? Yeah, sure, I will. Now, next question, please. Okay, the next question is, what would happen to the elimination half-life? What would happen to the elimination half-life and plasma concentration of a drug that follows first order kinetics if the dose is doubled? Okay, if the dose is doubled, what happens? Half-life, plasma concentration, what happens? Yes, tell me what happens to the half-life first, tell me. What will happen to the half-life? Half-life, very good. Half-life remains constant. Excellent. What about plasma concentration? First order kinetics. What about, no, plasma concentration, why will it be constant if you're increasing the dose of the drug? How can the plasma concentration be constant? Plasma concentration, yes. Decrease? If you're increasing the dose of the drug, it will decrease. Proportional. Proportional ka matlab, the plasma concentration is also going to double. If you're increasing the dose of the drug, plasma concentration definitely is going to double. Now let's quickly understand the difference between zero and first order. Again, important, what happens to what in zero and first order kinetics. So now here what you're supposed to know is these are the four variables. So don't remember, no need to remember for both zero order and first order. Remember only for one. Remember for first order and opposite will be true for the zero order. Simple. ठीक है? अब एक तरीका, what is, how can you remember this? Half life को क्या होता है, elimination को क्या होता है, clearance को क्या होता है, and plasma concentration को क्या होता है in the first order. Now, first order, first we know that a constant fraction. You should know here a constant fraction of the drug is being eliminated per unit time, and in zero order it's a constant amount. ठीक है, ये मेजर डिफरेंस है, इसमें जीरो ऑर्डर में अमाउंट है और F for first, F for fraction. That is being. Now, half-life, elimination, clearance. Plasma concentration हमने दोनों में एक चीज है, they will increase, double या whatever the plasma concentration, it is going to be increased, whether it is your zero order or it is your first order. So that is sorted. Now let's say तीन चीजें आ गई यहाँ पे. See first, अगर आप let's say for example for us medicos ऐसा होता है कि हमेशा we try to, हम अव्वल आने की कोशिश करते हैं, फर्स्ट आने की कोशिश करते हैं, and हमारी हाफ लाइफ, आधी लाइफ एग्जाम्स में गुजर जाती है, गिविंग एग्जाम्स, ठीक है, एंड फर्स्ट आने की हमेशा वी आर कॉन्स्टेंटली वी वांट टू कम फर्स्ट, एटलीस्ट वी वांट टू be in the topmost tier throughout are the exams. So half life में हम constantly first आने की कोशिश करते हैं. तो क्या है आपका half life constant है. और हम constant आने के लिए we need to clear those exam constantly. So clearance भी हमारी constant होनी चाहिए. फर्स्ट आने के लिए हाफ लाइफ में, हाफ लाइफ तक, उसके बाद तो चलो वी हैव लाइक स्ट्रगल्स ऑफ जॉब एंड एवरीथिंग, बट half of our life is spent in giving exams. So we want to aim, we want to come at least in the first few ranks in those exams. So half life constantly हम first आने की कोशिश करते हैं and हम clear करने की कोशिश, constantly clear करने के exams clear करेंगे तो ही हम top tier में जाएंगे. So ये दोनों चीजें half life और clearance constant रहती हैं. Definitely eliminate, we don't want to be eliminated in any of the exam. अगर हम बाहर निकल के exam से we cannot be first. So elimination should not be constant in this case. Elimination is variable. ठीक है? So half life, clearance is constant, elimination is variable. ठीक है? And if you want to learn even more, so that is directly proportional to the plasma concentration. This happens in your first order kinetics. Now you know the first order. उल्टा कर दो, ऑपोजिट, एवरीथिंग विल गो इन द जीरो ऑर्डर. सो हाफ लाइफ जीरो आने के लिए जो हाफ लाइफ, थैंक यू श्वेता, जीरो आने के लिए हाफ लाइफ इज कांस्टेंट, हमें कोई मेहनत करने की जरूरत, इट इज वेरिएबल. एलिमिनेशन कांस्टेंट रहेगा. जीरो, अगर जीरो आ रहा है किसी के मार्क्स तो वो कॉन्स्टेंटली एलिमिनेट ही हो रहा है हर एग्जाम में. सो एलिमिनेशन एक्चुअली इज कांस्टेंट. एंड क्लियरेंस, बिकॉज यहाँ कांस्टेंट है तो यहाँ पे कांस्टेंट नहीं होगा. क्लियरेंस इज ऑल्सो गोइंग टू बी वेरिएबल. ठीक है? सो अगर इसको, इट इज इनवर्सली प्रोपोर्शनल टू द प्लाज्मा कॉन्सेंट्रेशन. सो दीज आर द इंपॉर्टेंट फोर, रादर फर्स्ट थ्री आर मोर इंपॉर्टेंट. प्लाज्मा कॉन्सेंट्रेशन रिमेंबर दोनों में इंक्रीज ही रहेगा, पर जो हाफ लाइफ, एलिमिनेशन, क्लियरेंस, व्हाट हैपेंस टू ईच ऑफ देम इन फर्स्ट ऑर्डर और इन जीरो ऑर्डर, एब्सोल्युटली मस्ट नो. सो अंडरस्टूड दिस? फर्स्ट ऑर्डर में क्या डिफरेंस है, जीरो ऑर्डर में क्या डिफरेंस है, and which are the drugs which follow zero order kinetics? Can you tell me in the chat box? Drugs following zero order kinetics. Quickly, important drugs following zero, because first order most of the drugs follow. So we don't have to remember first order examples. I want you to know the zero order. Hamesha we should know what is different, which is, it is not the norm. Phenytoin, excellent. Pseudo zero order kinetics. एंड विच ऑर्डर कौन सी करती है, एंड सूडो जीरो ऑर्डर कौन सी करती है, फॉलो करती है ऑर्डर. द क्लास is it stuck again? I've tried to come back, and can you please confirm, is it still stuck? All good now. Thank you, Samta Jogi. Thank you so much. All right, let's get to the next one now. Comparison of efficacy. Comparison of efficacy of a new analgesic with an existing drug is done in. ठीक है? Comparison, please remember. Thank you everybody for confirming, it's fine. Now, so please look carefully. It is comparison of efficacy of a new analgesic with an existing drug is done in. Akash says 4. Okay. Change your internet service provider. Oh, it's actually the Jio. I mean, I'm not sure, but it works very well. I don't know what the problem is. Okay. 2. Dr. Metroid says 2. Dharmendra says It is 5G. Actually, it is 5G. The connection is 5G. That's why I'm so surprised. It's 5G. It's still stuck, right? 3. Okay. Is it okay? Okay. Just remind me if again there is an issue because I don't know what is the happening. It's 5G. Now, okay. So it's phase 3, right? So let's quickly do the phases. Please, again, I'm doing the phases now. So let's start. See, remember, जो phase 2 है, phase 2 is for establishing a therapeutic efficacy, but phase 3 is for comparing or confirming the efficacy. So remember, जब comparisons होते हैं, that is in phase 3 with an active drug, but initially it is phase 2. So don't get confused here. ठीक है, so let's quickly get to the clinical trial summary में होता क्या है. So initially what happens is your investigational new drug आती है, and then phase 0 is not, some do, some do not do, mandatory to nahi hai, but like it is done in very few number of participants, and these are all your healthy volunteers. ठीक है, so healthy human volunteers, very few. No blinding is required here, not required because it is healthy participants, and the aim of microdosing is just to know about the bioavailability basically of the features, कि whether ये जो drug हमारी है ये whether इसकी suitable kinetics हैं भी कि नहीं, whether we should go in and spend so much money to get into the phase 1 trial. So this is just about the bioavailability. Phase 1, it comes into, again there are healthy human volunteers, and the number here will be just very few, 20 to 80 participants. No blinding is required, and because they are healthy participants, safety issue is the only thing you can see. You cannot see any efficacy here because उनको disease तो है नहीं, ठीक है. So human इसमें, so safety, and you have to see the maximal tolerated dose निकल सकती है इसमें से, and then it is your safety and other parameters. So maximum tolerated dose is the main aim of why you want to do this phase 1. Phase 2, now you're going to explore the therapeutic efficacy of that drug. So you increase the number and you move into patients now. That's how you can get to know about the efficacy of drug. So move to patients now, and about 100 to 500 patients here in 2 to 4 centers. In 2 to 4 centers. Blinding, yes, they can be blinded. You have efficacy of a drug. Now, efficacy of a drug we know now. Now you have to establish or compare the efficacy, confirm. और confirm कैसे किया जाता है? Already जो existing drug है for that particular disease, we try to compare the new one with that and see whether it is actually efficacious or not. So the confirmatory trial is of phase 3, and you go on to more number of patients in thousands basically now, 500 to around 3000 patients in many centers. ठीक है, and this is your double blind study. So this is mostly double blinded study, and you are here going to compare or establish the efficacy of the drug. है ये efficacy ही, but you are now going to establish this, confirm this. ठीक है, and against ये हम comparative trials हम यहीं पे करते हैं. So you compare with the existing therapy. Then your new drug application gets submitted, okay? And now the drug is into the market now. And when the drug is into the market, this is called as post-marketing surveillance in the general population. In the general population, no blinding is needed now, because what you are giving this medicine as a practitioner to the general population. So अब यहाँ पे क्या होगा, because you're giving it to a large number of patients here, you will know about even the very rare side effects वगैरह, uncommon side effects. Now they will come into picture because now you're giving it to lakhs and millions of people you're giving. So even the ADR monitoring and everything is done during this phase only. Pharmacovigilance studies also, they are done here only. And you can study the effects, like you can give it in special population groups, elderly वगैरह में देते हैं, and you can get to know the effects over there. So this is the clinical trial summaries. What are the important aims of each and every trial? Very important again to know. Now let's go on to the next one. Is this was asked in the previous exam, you know, it was a NEET PG, I think, yes. The digoxin plasma concentration is 4 nanograms per ml, and the doctor wants it to reach the therapeutic plasma levels of 1 nanogram per ml. How much time will it take, considering the half-life of digoxin is 40 hours? Very good, Mnemonic King. It's 80 hours. 80. Excellent. ठीक है? It's a simple one, because half life दिया हुआ है, it is 40 hours. So first half life में it will come to 2, and the second half life में it will come to 1. So यहाँ पे 40, यहाँ पे 40. Yes. So total half life इसकी मतलब total time taken to reach 1 is it's 80 hours, right? So digoxin का ये important चीज़ है, half life. Excellent. Now next, this one. Glucagon acts via cyclic AMP, cyclic GMP, cytoplasmic calcium, or intracellular calcium. Mnemonic, please. Campylobacter. C. Prasanna says cyclic AMP. Yes, excellent. Yes, the correct answer is 1. Yes, it is 1. It is cyclic AMP. So cyclic AMP कौन से? Which are the type of receptors here involved? These are your G protein coupled receptors they're talking about. ठीक है? So basically they're asking it acts via which receptors? So G protein coupled receptors. So जो G stimulatory है, they increase the level of cyclic AMP. जो G inhibitory है, they decrease the level of cyclic AMP, and also they cause actually increase the potassium, improve or they increase the potassium exit, right? और ये cytoplasmic calcium increase करते हैं intracellularly. These are your GQ types. Cyclic GMP is basically all the drugs acting on the guanyl cyclase. Very good. G protein. So few examples which have been asked before, I will just highlight those जो पूछे गए हैं पहले. So say for example G stimulatory कौन से? So all your beta receptors, ठीक है? All your beta receptors are GS type. GS type, ठीक है? So यहाँ पे beta receptors are GS type. Dopamine 1. Glucagon अभी they have asked you. So glucagon again you can remember. H2. ठीक है? H2 is here. Now see all the stimulatory hormone FSH, LH, ACTH, TSH, so they are G protein coupled receptors. मगर अगर हम बात करते हैं estrogens and thyroid hormones and steroids, they do not belong, उनके receptors are not G protein coupled receptors. तो steroids के जो receptors है, they belong to which category of receptors? To which receptors do they belong? Yes, come on. कौन सा receptor type को belong करते हैं? The steroid group belongs to which category of receptors or which type of receptors? No? So steroids and all, they are your nuclear receptors. ठीक है? So they are your nuclear receptors. But FSH, LH, ACTH or TSH, very good Pradeep. They are all G protein coupled receptors type S. So please understand, अगर पूछा जाता है TSH पूछा गया है, कि thyroid hormone पूछा गया है, estrogen पूछा गया है, कि FSH and all those पूछे गए हैं, ACTH पूछा गया है, corticosteroids पूछा गया है, just see which receptor has been asked. So let's come to the next one, which is your GI type of receptor. ठीक है? So alpha 2 belongs here. Alpha 1 is GQ, alpha 2 is GI. ठीक है? So because alpha 2 is presynaptic and inhibitory होता है, because presynaptic autoreceptors inhibit the release of the catecholamine, ठीक है? So therefore they are G inhibitory type, and alpha 1 is present on the blood vessels. They cause contraction. Contraction is because of calcium. So they are GQ type. Now M2 receptors is present in the heart. It is of GI type. B1 is on the heart. That is of GS type. So that is the difference here. M1, M3 belonging to ion channel. Muscarinic type of receptors are they? take a snapshot of this later, बाद में इसको देखना which of the receptors, a few examples are important for this. सारे तो हम याद नहीं रहेंगे, but whatever few are there you can remember. So जो ये highlighted है, they have been asked before, so just at least make sure that you know these receptors, the one which have been asked. ठीक है, so these are the important GPCR receptors. Manish says it's not working. Is it really not working again? God, there's some issue. Is it not working? From my end, it is fine. I'm not sure. Working? Okay, okay. Thank you. Yeah. All right. Drug not given with ketoconazole. All of the above? Yes. Dr. Metroid says all of the above. Yes. It is all of the above. Excellent. And what is the reason? It should not be given because ketoconazole is an enzyme inhibitor. ठीक है? Okay. It is an enzyme inhibitor. So ketoconazole is an enzyme inhibitor. That's why when it is given with the other drugs, yes, so there are a lot of chances of drug interactions. And in case the other drug is mandatory, you have to give the other drug. What should you do to the dose of the other drug? Increase or decrease? अगर आपको ketoconazole के साथ the other drug has to be given, so what do you do to the dose of the other drug? Whether you increase the dose of the other drug or decrease the dose of the other drug? Very good. Yes, you decrease the dose of the other drug. So quickly going to the examples of what various important enzyme inhibitors. So there's a mnemonic. There are so many in the market, but what I say is alcohol and coke, they inhibit your cardiovascular system. Okay. All right. Yeah, maybe. I guess I'll see to that. Alcohol and coke inhibit your cardiovascular system. Okay, so they're bad for the cardiovascular system. So remember, so alcohol, yes, so alcohol जो है binge acute intake, that's an inhibitor, but long-term chronic ingestion of alcohol, that is an inducer. But binge अगर alcohol किसी ने लिया उसी time acute है, that is a inhibitor. Then coming to coke, C-O-K-E, that is your, very good, cimetidine, omeprazole, ketoconazole, erythromycin, very good, erythromycin, IN is for isoniazid, again cardiovascular, or CV is your ciprofloxacin and valproate. ठीक है, valproate, erythromycin and valproate. Now these are your important enzyme inhibitors. So इसमें आप याद रख सकते हो ये सारे. So ठीक है, ये alcohol, coke inhibit cardiovascular systems. Remember, these are the examples. Yeah, these are, there are so many others also. There's a list of this, but these are the more important ones that you have to know. Similarly, अगर आप enzyme inducers की बात करें, then you remember simple GPRS, and GPRS में, yeah, grapefruit juice is also an inhibitor. So GPRS में you do griseofulvin, yes. See, you can have your own mnemonic and increase it as such, yes. Griseofulvin, P is for phenytoin, R is for rifampicin, S is for smoking, even alcohol intake. अगर chronic alcohol intake है, that also leads to this, ठीक है? GPRS cell phone, C and P. ठीक है, C and P is your carbamazepine and phenobarbital. So mostly these anti-epileptics are from in family of inducers. except for valproate. Valproate is an enzyme inhibitor and it is not an inducer. Remember that. So GPR is cell phone inducers, inhibitors. And inducers के तहत you have to increase the dose of the other drug. Very classic example जो हम करते हैं, rifampicin with oral contraceptive failure. This was a question. So what should you do to the, or what kind of drug is this? Enzyme inducer है, inhibitor है, and what you can do to the dose of the other drug. ठीक है, जैसे oral contraceptive है, the patient has to be advised to use a alternative method of contraception. That kind of example. ठीक है, so ये एक important हो गया this इसमें. Yes, coming to the next one now quickly is category X drugs are all except. Category X drugs are all except. So this is category X, not schedule X. Category X. 4. Simvastatin. Dr. Matroy says simvastatin. Yes. Any other? Let's do category X drugs. So these are the categories in pregnancy. ठीक है? Campylobacter says 3. All right. Warfarin. Warfarin. Okay. Prasanna says warfarin. Pratik says C. C is alprazolam. Okay. 4 and 3 confusion. Okay. Right. Yes, it is a confusion. So actually the correct option is alprazolam. ये actually category D में है. अभी X में नहीं. Though it is said benzodiazepines are not safer in pregnancy, but still इसकी category D है. So category X are basically all your teratogenic drugs. Now, what are the important teratogenic drugs and what? Yes, benzodiazepine है अभी category उसकी D है. Though it is not safe, but it is in category D. So category D क्या होती है? They are unsafe, definitely, but you will have to see the risk-benefit ratio. So it is not in the category X yet, ठीक है? So it is in a category D. तो हमने category question पूछा है कौन सी drugs उन्होंने category X में की हैं, ठीक है? Now these are some of the important drugs जिनकी teratogenicity पूछी गई है बहुत बार एग्जाम्स में, and these are your must know drugs जिसकी आपको आनी चाहिए. So ACE inhibitors absolutely contraindicated in pregnancy because they have a lot of teratogenic effects. So whether it is your pulmonary hypoplasia, bony malformations, renal effects, that is seen by the, whether it is ACE inhibitor, ARBs, not to be given. Warfarin, somebody had written here, see warfarin causes fetal warfarin syndrome. So ये जो जितने भी syndrome वाली drugs हैं, ये all teratogenic है. Fetal Hayden-Toyne syndrome, alcohol syndrome, warfarin syndrome, ठीक है? So never, they are not given. So warfarin, nasal hypoplasia, you will see the and short limbs, skeletal deformities. Phenytoin, fetal Hayden-Toyne syndrome. Classically, you will see in the fetus, they will have a cleft lip or a cleft palate. Valproate. So valproate again, this is this is the most teratogenic drug. Very teratogenic drug hai. Neural tube defects and spina bifida. Lithium, Epstein's anomaly. Carbimazole, methimazole, anti-thyroid drugs में जो कि हम first trimester में बिल्कुल नहीं देते. Corneal atresia, aplasia cutis, and esophageal atresia. So aplasia cutis means skin is missing actually. So they can even, if there's a picture shown जहाँ पर एक बच्चे का सिर दिखाया गया है and in the upper part there is no skin there, so that is aplasia cutis. So first trimester में never to be given carbimazole, methimazole. If you have to give an antithyroid in first trimester, propylthiouracil is the safer option. Thalidomide, phocomelia, ठीक है? Thalidomide, phocomelia. Tetracyclines, bone defects, teeth discoloration, cartilage problems. Aminoglycosides, fetal ototoxicity. Methotrexate also, all these. Microcephaly, craniosystosis, heart defects, limb abnormalities. So all these are your important category X drugs that you must know, right? All right. चलो next question पे आते हैं. Yes, actually देखा जाए unsafe हैं. Yes, fluoroquinolones are not to be given either, not to be given. Safest antibiotics in pregnancy, if you ask me, these are your penicillins, ठीक है, एरिथ्रोमाइसिन जो पेंसिलिन ग्रुप्स है, एरिथ्रोमाइसिन, उसके अलावा हम वी डोंट प्रेफर टू गिव, ठीक है. सो दैट, सो फ्लोरोक्विनोलोन्स आल्सो नॉट टू बी गिवन. चलो, this one, please tell me. In a 2-year-old child, a refractive error test is done using 1% atropine ointment, 1% atropine eye drop, 0.5% tropicamide, 0.5% pilocarpine. कौन सा? Dr. Metroy says 1, okay, good. Pratik says 4, pilocarpine, okay. Pratik says 4, or Pradeep says 1, Bhavani says 1, Sachin says 2, okay. Pratik says 4, Prasanna says 1% drop, okay, drop, that is 2, alright. चलो, so refractive testing में जब हम आईज की टेस्टिंग कराने जाते हैं, very good, yes. So what do you are looking for, mydriasis or are you looking for meiosis? Actually 4 आंसर किया था ना, मैं इसलिए पूछ रही हूँ किसी ने. जब आप आई टेस्टिंग कराने जाते हैं तो क्या हम मिड्रियासिस चाहते हैं कि मायोसिस चाहते हैं? आपने अंदर टेस्टिंग करनी है, मिड्रियासिस चाहते हैं. सो मिड्रियाटिक, पाइलोकार्पिन इज अ मिड्रियाटिक और इज इट अ मायोटिक? पाइलोकार्पिन इज अ मायोटिक, ठीक है. सो दिस इज आउट ऑफ क्वेश्चन हियर. तो वैसे ही बाहर एलिमिनेट हो गया ऑप्शन, जो मायोटिक हमें चाहिए ही नहीं. दिस इज यूज्ड इन ग्लोकोमा, सो ग्लोकोमा में मायोसिस चाहिए, मिड्रियासिस नहीं. सो देयरफॉर इट इज आउट. रह गए 3 चीजें, एट्रोपिन, ट्रोपिकामाइड. अब इन दोनों में से, बिकॉज इन चिल्ड्रन व्हाट यू वांट टू डू, यस, you want to do mydriasis, and because you want to paralyze their ciliary muscles, they have a very high ciliary tone, and अगर उसका tone ज़्यादा रहेगा the error cannot be correctly measured, yeah, mydriasis. So you need to paralyze that tone, ciliary muscle, so you need cycloplegia उसको कहते हैं. ciliary muscle को अगर हमने paralyze करना है, cycloplegia. So atropine does both the jobs very well. It is a very strong cycloplegic and it is a mydriatic. And बच्चों में, because they have a very strong ciliary muscle tone, you want to do cycloplegia there. So you give atropine. Tropicamide is given in adults. Because atropine in adults can't be given because they have the effect stays for over a week. And अगर week के लिए mydriasis रहेगा, you can't work. So इसलिए adults में we cannot give something which is working for a week. So tropicamide works for 3 to 6 hours. Therefore, it is preferred mydriatic or preferred drug for refractive error testing in adults. अब प्रॉब्लम है, और यार अब ये हमारे 2 चीजें रहेगी. इसमें से अब देखना, ऑइंटमेंट देना चाहिए कि आई ड्रॉप देना चाहिए. अब क्या होता है, एट्रोपिन बच्चों में, लेट्स से एट्रोपिन क्या प्रॉब्लम क्रिएट करता है? व्हेन इट सिस्टेमिकली अगर दे तो एट्रोपिन क्या क्या प्रॉब्लम कॉज कर सकता है? The major issue with kids is that atropine leads to decrease in all the secretions and even the sweating. So it can lead to hypothermia, atropine fever, which is dangerous in children. So eye में अगर आप drops देते हो, so through the nasolacrimal duct, it can percolate and enter into the systemic circulation, so it can have side effects. Ointment is little thicker and it is less probable कि होता है कि वो nasolacrimal duct के through जाए, systemically absorb हो. So इसीलिए the best option here would be to give an atropine ointment and not an eye drop. ठीक है, eye drop अगर कुछ भी नहीं दिया तो atropine prefer करोगे, but because atropine is parasympatholytic, right? Parasympathetic नहीं है. Atropine is a muscarinic blocker, so they cause dryness. ठीक है, so they cause dryness everywhere. So atropine, eye drop की जगह prefer a ointment. This is the reason. Yes, all the issues mainly, so जितने भी side effects हैं, they'll be more with eye drop as compared with ointment, because ointment thick होता है, difficult है to percolate through the nasolacrimal duct. ठीक है? All right, great. Next question. All the following are seen with isoxapurin except. All the following are seen with isoxapurin except hypotension, tolerance, hypokalemia या hypoglycemia. 4 is hypoglycemia. Surila says 2, tolerance. Okay, और बोलो. बस 2 options. Bhavani says 4. Surila says, oh, you can't see me. You can't see me? Okay. Prateek says 4. चलो question तो नजर आ रहा है. I can see the question at least. Alright, the correct option here क्या है? 4. Very good. Yes, excellent. They cause gluconeogenesis. So there the correct option हमारा होना चाहिए hyperglycemia, not hypoglycemia. ठीक है? So side effects of beta 2 agonist can say 3 times hypertension. ठीक है? H T T T. ठीक है? So these are the different side effects. ठीक है? So hypotension, hypokalemia and hyperglycemia. ठीक है? ये 3 important H's. T से आते हैं हम. Tremors, tolerance and tachycardia. But ये जो tachycardia है, it is only at high doses. ठीक है? High doses पे क्या होता है basically? There is loss of selectivity. ठीक है? So there is loss of selectivity. So इसीलिए high dose पे tachycardia है, not at low dose. But ये these are the important side effects of beta 2 agonist. ठीक है? Hypertension, hypokalemia, hyperglycemia, tremors most common, tolerance and tachycardia. Right? All right. चलो next वाला. Next question please. Esmolol is short acting because more plasma protein binding, gets metabolized by plasma esterases, it has high volume of distribution, yeah, it has high oral bioavailability. Egosphere says 2. Okay, Dr. Metroy says 2. Very good. Very good. Yes, the correct option is very good, Bhavani. It is 2. Very good, Masood. So it is getting metabolized, very good, Surila, metabolized by plasma esterases. That's why it has a very, very short half-life. It is given IV in urgencies. ठीक है? Hypertensive urgencies. Yeah, in any case of urgency it is given. It has a very, very short half-life. And इसकी प्लाज्मा प्रोटीन बाइंडिंग इज नॉट मच, अराउंड 50 to 55% ही है, कोई खास ज़्यादा नहीं है, इसलिए लो लिपिड सॉल्युबिलिटी है, सो यू कैन नॉट हैव अ हाई ओरल बायोअवेलेबिलिटी. नाउ लेट्स डू few other drugs. Can you give me examples of few other drugs, important ones, which are also metabolized by plasma esterases? 2-3 drugs important है जो they have been asked before, so let's do that. So important drug which is metabolized by plasma esterases, succinylcholine. Very good, succinylcholine. Mivacurium. Very acetylcholine. Okay, it's acetylcholine esterase. ठीक है, it is remifentanil. Acetylcholine we don't use it as a drug, हाँ, ठीक है ना, वो it is not used as a drug, acetylcholine, because it is getting metabolized. Succinylcholine, mivacurium, remifentanil, then cocaine and like drugs. Yes, so you can use these or the other drugs which have short half-lives because they are metabolized by plasma. So as soon as they enter the plasma, they get metabolized. That's why they have a shorter half-life. Very good. So ये 3 examples important है, just note them down. Now, clonidine. Next question on clonidine has all the following features except acts on alpha 2 receptors, can produce rebound hypertension or abrupt withdrawal, can be used in hypertension, and inhibits salivation due to postsynaptic alpha 2. Sorry, inhibits salivation. Okay. Dr. Nandamam says 4, or Metroid says 4. Vani says 4. Okay. Right. Okay, so it acts on the alpha 2 receptors, can produce rebound hypertension on abrupt withdrawal, can be used in hypertension, inhibits salivation. ठीक है, all of you are correct here. So ये जो rebound hypertension है ना, ये एक क्वेश्चन में आया हुआ है, ठीक है. लास्ट टाइम इट्स एन अल्फा 2 एगोनिस्ट एंड इट प्रोड्यूसेस रिबाउंड हाइपरटेंशन, ठीक है, एंड दैट इज बिकॉज ऑफ इंक्रीज इन द सेंसिटिविटी ऑफ द clonidine is used. It is your Sjogren's is dryness, so you will use drugs like pilocarpine, cevimeline, those kinds of drugs in Sjogren's syndrome, ठीक है. Yes, so the alpha 1 receptors become hypersensitive. So ये एक चीज है. This is the presynaptic receptor and the postsynaptic one. So यहाँ पे आपके alpha 2 receptors हैं, and postsynaptically we have, yes, cevimeline is used and pilocarpine. They are used for Sjogren's. Clonidine नहीं है ना, क्योंकि they are going to Sjogren's में there is dryness of the mouth and the eyes and all those things. So you need to increase the secretion. So those drugs will be used. So alpha 1 is here. So what you do when you give clonidine, what happens? Clonidine acts on the alpha 2 receptors and it's an agonist on the alpha 2 receptors. And you know that जो autoreceptors या presynaptic receptors होते हैं, they are not going to allow the release of noradrenaline. ठीक है, that's how they work as an antihypertensive drug, because the noradrenaline will not act on the alpha 1 and not cause increase in the blood pressure. So what happens if the patient misses a dose of clonidine? पेशेंट एक सिटी से दूसरी सिटी चला गया, भूल गया दवाई लेना, तो क्या हो सकता है विदिन 2 or 3 days अगर क्लोनिडीन नहीं ली उसने. So this is because when he's been taking clonidine for a long time, the noradrenaline is not able to be released. So जो ये alpha 1 receptors होते हैं, इनकी sensitivity बढ़ जाती है, ठीक है. So there is increase in their sensitivity. Alpha 2 की कम हो जाती है because that is continuously agonist is present, but यहाँ पे alpha 1 की sensitivity is going on increasing, ठीक है. So when the clonidine is withdrawn, there is a rush of noradrenaline which is being released, and because they're already very sensitive, so there'll be increase in the blood pressure, right? Increase in the blood pressure. और ये वाले down regulate हो चुके हैं, तो ये वाला effect कम हो जाएगा and ये वाला effect बढ़ जाएगा. So ultimately क्या हो रहा है? There is a high increase in the, or this is called the rebound hypertension. And what is the treatment for this? Drug used for treatment of rebound hypertension. What is the drug used for rebound hypertension? क्या होएगी? कौन सी ड्रग यूज करेंगे? Phentolamine. Very good. Phentolamine. So it's a alpha blocker you're using, ठीक है. alpha blocker you're using phentolamine. It is not beta. अगर आप beta blocker यूज करोगे तो क्या होगा? beta receptors तो अच्छे हैं, beta 2 will cause vasodilatation. Now you're blocking beta 2 receptors, तो फिर unopposed action of alpha 1 है, ठीक है. then there is unopposed action of alpha 1. you are increasing the BP in those patients, ठीक है. यहाँ पे the problem is the excess action on alpha 1 हो रहा है, तो आपको अल्फा 1 को टारगेट करना चाहिए. इमीडिएटली ब्लॉक द अल्फा रिसेप्टर्स. अल्फा 1 रिसेप्टर्स को आप ब्लॉक करें, एंड एज सून एज यू ब्लॉक द अल्फा 1 रिसेप्टर्स, noradrenaline will not act on them. So this is the treatment of choice. Immediate action है alpha 1 blocking, ठीक है. So let's got it. Okay, now tell me this one. Which of the following is a selective beta 2 blocker? Which of the following is a selective beta 2 blocker? Two. bitoxolol. Be very very careful in reading the question. ठीक है? Selective beta 2 blocker. Surila says 2. Okay, 1. All right. Or 1. So all of you are saying either 1 or 2. 1, 2. Beta 2 blocker हैं ये सारे. Okay. चलो. So the correct option is the third one. It is butoxamine. ठीक है? It is not this one. It is butoxamine. Please remember. No, not bitoxolol. It is a beta 1 blocker. Bitoxolol is a beta 1 blocker. Glaucoma में use करते हैं ना इसको. It's a beta 1 blocker. Yes, yes. Bitoxolol is a beta 1 blocker. So it is not a beta 2 blocker. It is a beta 1. Selective. So see, this is the only one which doesn't have a lol at the end. तो ऐसे याद कर लो कि बिटॉक्सामीन है. ठीक है? So याद कर लो कि जिसके जो लॉल नहीं है बिटॉक्सामीन है. It's a selective beta 2 blocker. Okay. So some important cardioselective. These are your cardioselective beta blockers. Important points about cardioselective beta blockers. नेबिवोलॉल. ठीक है? एक नेबिवोलॉल है. इसका इंपॉर्टेंट पॉइंट क्या होता है कि इट इज इंक्रीजेस द नाइट्रिक ऑक्साइड. इट कॉजेज द रिलीज ऑफ नाइट्रिक ऑक्साइड. सेलिप्रोलॉल, नेबिवोलॉल दोनों नाइट्रिक ऑक्साइड रिलीज करते हैं एंड दे हैव एडिशनल वेजोडाइलेटरी एक्शन. ठीक है? नेबिवोलॉल, सेलिप्रोलॉल, एडिशनल वेजोडाइलेटरी एक्शन. लॉल हो गया. ओके. ठीक है? बिटॉक्सोलॉल, बीटा 1 blocker used in glaucoma. Bisoprolol is a drug which is used in CCF. ठीक है? Atenolol again they are used in a very important drug for hypertension में यूज होती है. एस्मोलोल अभी किया. शॉर्टेस्ट acting beta blocker used in as IV in emergency cases. Acebutolol is a drug which has intrinsic sympathomimetic activity, and metoprolol, another very important drug, which is used in hypertension, CCF, myocardial infarctions. ठीक है? So ये जो है property of intrinsic sympathomimetic activity with membrane stabilizing action is also seen in propranolol, pindolol, oxprenolol. ठीक है? Propranolol, pindolol or oxprenolol. Yes, it is also seen with this. Then we have alpha plus beta blockers जो important है. labetalol, carvedilol and buxendolol. ठीक है? ठीक है? Sotalol is a non-selective. It is not cardioselective. ठीक है? And it is a potassium. It also has a potassium channel blocking action. ठीक है जी. Beta alpha plus beta blockers. Labetalol. You know this is a drug which is used in hypertensive, drug of choice for hypertensive emergency in pregnancy. No, all of them are. It's not a question. I'm just telling you about the alpha plus beta blockers. ये सारे हैं. ठीक है? So hypertensive emergency in pregnancy. Carvedilol का important feature क्या है? It also additionally has a antioxidant property. Antioxidant property, also it's important drug used in CCF and hypertension. So ये तीन आपके अल्फा प्लस बीटा ब्लॉकर्स हैं. ठीक है? So ये कुछ important points थे. Yes, pregnancy में we prefer this drug. ठीक है? About beta blockers. Now let's come to the alpha blocker question. Alpha 1 blocker without any effect on blood pressure. कौन सा है? Oh, this is the question. Alpha 1 blocker without any effect on blood pressure. Dr. Matoy says 1, tamsulosin. Okay. Or Honey says 1. Very good. Very good. Very good. Tamsulosin. Excellent. Yes, it is for this only. So, Reela 1. So, all of you are absolutely correct. It is tamsulosin. Okay? So, tamsulosin is the drug which acts only selectively on alpha 1. Yes, yes. Very good. Alpha 1A. जो ये alpha 1 है ये ज़्यादातर more on the bladder and urethra. और जो 1B है that is predominantly on your blood vessels. ठीक है? So tamsulosin has more affinity for 1A. Yes, so this is a drug which is used in benign prostatic hypertrophy. ठीक है? और एक जो इसमें important side effect आता है it is floppy iris. ठीक है? During the cataract. So tamsulosin का important point. So remember this one. While जो prazosin, doxazosine, tazosine, they are not specific. ठीक है? So they are not specific. They act on alpha 1A also as well as 1B also. Now some important points about prazosin. उसके लिए क्या important चीजें हैं? एक, it is a drug of choice in scorpion sting. ठीक है? ये question भी आया था. Drug of choice in scorpion sting. It was asked in the last exam. Where is scorpion sting, scorpion bite? ठीक है? And it is used in case of patients of BPH who also have hypertension. अगर patient of BPH also have hypertension, then we prefer to use prazosin. ठीक है? So ये आपकी important drugs हैं which you need to know. ठीक है? It causes first dose hypotension. Sorry, first dose effect जिसको हम कहते हैं. ठीक है? First dose effect. Postural hypertension. It is seen with this. इसके लिए क्या करना चाहिए? That start with a smaller dose or ठीक है? Give the dose at night or start with the smaller dose and then you escalate and tell the patient जब उसको if he has to get up from lying down position to a standing position, then slowly he should get up. He should immediately get up. He should first sit down and then after some time get up. So these are some instructions that you can give. Yeah, either at bedtime, yes, or you start with small doses and then escalate. These are the instructions that you give. Right? Okay. Now, chalo, next question. बताओ फटाफट. ये easy है. ये already हमने discuss कर लिया. So it's a repetition, kind of repetition. Already we discussed. So this should be very easy. Which is a false statement. Esmolol is metabolized in liver. Celiprolol has vasodilator property. Nebivolol releases NO. Metoprolol used in CHF and prolonged survival. ठीक है? So अभी we have discussed all the beta blockers. Very good, very good. Yes, one is false. अभी हमने किया because it is metabolized by plasma esterases. ठीक है? So that's important. Excellent. चलो, next one. Drug recently approved to be used along with phentermine in the management of obesity. Very good. Yes, esterase. Excellent. All of you. चलो इसका क्या ऑप्शन है? Recently approved to be used along with phentermine in the management of obesity. Pratik says 1. Okay. Dr. Nandavam says lorcaserin. Dr. Matoy says 3. Orlistat. ठीक, क्वेश्चन ये है कि अप्रूव हुई है इन कॉम्बिनेशन विद फेंटामिन. ठीक है? सो दैट्स द क्वेश्चन. सो यूज्ड अलोंग विद फेंटामिन, ये वाला दिस इज यू हैव टू नो. Bhavani says sibutramine. Sibutramine is banned now. ठीक है? So sibutramine is no longer used. 2-4 topiramate. Excellent, Rohit. Yes, Dr. Nandavam. Very good. So it is topiramate. Yes. Topiramate is the correct option. It has been recently approved in combination with phentermine. ठीक है? Topiramate otherwise कौन सी drug है? Which class of drug does topiramate belong to? Yes, which class of drug does topiramate belong to? It is actually an very good, Dr. Matoy. It is an anti-epileptic drug. ठीक है, वहां पे क्या कर रही थी? It was causing weight loss. So that property we took and हमने उसको यूज किया कि why not use it in patients to lose weight. ठीक है, और टोपायरामेट का और क्या एक साइड इफेक्ट होता था वहां पे? It can cause stones. ठीक है, रीनल स्टोन्स कॉज करती थी. दैट वाज अनदर प्रॉब्लम विद टोपायरामेट. चलो, ड्रग्स फॉर ओबेसिटी की बात करें. यस, रीनल स्टोन्स. ड्रग फॉर ओबेसिटी GLP-1 एनालॉग्स यूज करते हैं, विच इज योर लीरा ग्लूटाइड. ठीक है, एंड सीमा ग्लूटाइड. GLP-1 analogs, liraglutide and semaglutide. Oral lipase inhibitor, orlistat. तो combinations यही हैं, phentermine topiramate, even bupropion with naltrexone or bupropion with zonisamide is also used. We do not use these drugs. ठीक है, cardiotoxic drugs हैं, valvulopathies, cardiac defects they causes, so they are no longer used. Sibutramine, fenfluramine is no longer used. पहले यूज करते, पहले हुई थी, it was introduced but it is no longer. So use यही वाली drugs होती हैं that you start with the GLP-1 analogs, नहीं फर्क पड़ता, then you go to the oral lipase inhibitor and then to the combinations. So these are your drugs for obesity, right? Sure. Now, which among the following is contraindicated in myasthenia gravis? Which among the following is contraindicated in myasthenia gravis? All? Why do you think all will be contraindicated? 4, 4, 1, okay. 4, कोई reason देना चाहिए. Why do you think they are contraindicated? Sulfonamides, okay. Why? What is the reason? Why will they be contraindicated? Myasthenia gravis है weakness in the neuromuscular junction. ठीक है, anything which is going to enhance this property should be, yes, very good, automatic. So the correct option is aminoglycosides. So aminoglycosides, they actually decrease the effect of acetylcholine on the neuromuscular junction at the NM receptors. So these drugs should not be used in patients of myasthenia gravis. Now, can you tell me the drug for myasthenia gravis? Treatment of myasthenia gravis. Which drug is given? कौन सी ड्रग देते हैं for the treatment of myasthenia gravis? Yes, Pratik, one, you are absolutely correct. Neostigmine. So we give neostigmine, or we can give pyridostigmine. Now, why not physostigmine? Because it crosses the blood-brain barrier. Now, my second question is, अगर आपको option आता है treatment for myasthenia gravis, whether you will give neostigmine or you will give neostigmine plus atropine, दोनों में से कौन सी देंगे? Only neostigmine or neostigmine plus atropine? Which will you give? Two, yes, combo, very good. You will give this one. If you are asked, if given two options, then you must choose neostigmine with atropine because you have to block the muscarinic effects. Okay? The muscarinic actions have to be blocked alongside. Very good. All right. So, few drugs which are contraindicated in myasthenia gravis. So, एक आपने हमें अभी किया aminoglycosides, right? Then any neuromuscular blocking agent, they need to be avoided within these patients. Calcium channel blockers, then morphine because it causes respiratory depression, then magnesium sulfate. It also inhibits the acetylcholine release. So these drugs should not be given when patient is of myasthenia gravis. Okay, which is a drug used to differentiate between myasthenia crisis or the cholinergic crisis? कौन सी ड्रग देते हैं to differentiate between myasthenia crisis and cholinergic crisis? Quickly, which drug differentiates between the two? Myasthenia crisis and cholinergic crisis. Very good. Edrophonium. टेस्ट का नाम क्या है? टेस्ट का नाम एड्रोफोनियम टेस्ट है. टेस्ट का नाम you have to, yes, you have to be very careful in these here. Edrophonium tensilon test. Tensilon test. Yeah, very good. Tensilon test. Which of the following anti-glaucoma? Next, let's quickly go to this question. ये तो this topic, please. ये तो I think this is the very very important topic. Anti-glaucoma drugs. ठीक है? Following anti-glaucoma drug can cause heterochroma iritis. 2. Latanoprost. Yes, so all of you know this. Okay? It is latanoprost. Prostaglandins leading to heterochroma iritis. So adverse effects of anti-glaucoma drugs, absolutely must know drugs. Okay? Must know things. Color in the eye. Yeah. So beta blockers, basically if you're using a non-specific blocker like timolol. ये भी question आया था एक बार. तो timolol किन patients में हम नहीं दे सकते? Some patient already has asthma or patient has some cardiac problem. CHF का कोई patient है या any cardiac defect. So AV block and all. So non-selective beta blocker not to be given. Therefore in beta blockers are bitoxolol. Though it has less efficacy than timolol, but it is safer in these patients. ठीक है, so this is beta blocker. Prostaglandin analogs जो हमने किया latanoprost, pigmentation of the iris called as heterochroma iritis. Then the eyelashes are thick and long, which is called as hypertrichosis. Dense eyelashes, macular edema. These are the important adverse effects with prostaglandin analogs. Dipivefrin, which is a prodrug for epinephrine, leads to conjunctival pigmentation. So remember, अगर पूछा जाए iris का pigmentation, the drug causing that is your prostaglandin analog. But अगर conjunctival pigmentation है, then the drug causing that is your dipivefrin. So that is important to see which it has been asked. ठीक है? Brimonidine, aproclonidine जो alpha 2 agonists हैं, they are causing lid retraction and should not be given in children less than 2 years because they can also lead to apnea in the newborns, not to be given there. Myotics like pilocarpine and like drugs, ठीक है, broache, follicular conjunctivitis can cause retinal detachment. Carbonic anhydrase inhibitors, brinzolamide like drugs can lead to corneal edema. एक ये different है, corneal edema, macular edema, दो अलग चीजें. The new drug rho kinase inhibitor, which is your nitarsodil, can cause conjunctival hyperemia and hemorrhages. So ये जो table है, ये बहुत important table है. Picture पूछ देख सकते हैं, then like इसका picture has been asked, heterochroma iritis का, ठीक है, it has been asked. तो वहाँ पे they will show you the iris pigmentation, that which of the drug is causing this. They can show you dense eyelashes, which of the anti-glaucoma drug is causing this. So ये वाला table is absolutely very very important. Okay, चलो, let's go to the next question. Olopatadine is. This is one question that you can memorize. ये कौन सी ड्रग है, किस ग्रुप को बिलोंग करती है, ठीक है, बहुत डिटेल्स नहीं करेंगे इसकी, जस्ट किस ग्रुप को बिलोंग करती है एंड कहाँ यूज करते हैं. Very good, Rohit. It is both. Excellent, all of you. Okay, ठीक है. Mast cell stabilizer, antihistamine, दोनों effects हैं इसके, ठीक है. It is, so this is the correct option. Mast cell stabilizer, antihistamine, ठीक है. So this जो olopatadine है, it is used in allergic कंजंक्टिवाइटिस, ठीक है. अगर जब इचिंग होती है बहुत ज़्यादा, इन दीज केसेस इट इज़ यूज्ड इन एलर्जिक कंजंक्टिवाइटिस. That's all you should know about this. Okay, yes, conjunctivism. Very good. All right. So now this one. Sildenafil acts by blocking. Sildenafil acts by blocking. Honey says 4. Snoka says 3. Surila says 3. Rohit Pandey 3. 3. Very good. Excellent. Most of you are on the right track. It is phosphodiesterase 5 enzyme. अगर मैं ऑप्शन इसको चेंज करके इफ आई राइट दिस देन क्या आंसर होगा 3. तो एक्शन जो होता है ना सिल्डेनाफिल का एक्चुअली जहां जिसके लिए इसको यूज करते हैं दैट इज बाय दिस. जो इसका साइड इफेक्ट है इन द आई that is blue green syndrome, that is because of this. So sildenafil causes a side effect in the eye, the visual, the blue green जैसे हम कहते हैं color defect है, that is because of blocking of the phosphodiesterase 6. yes, पर action जो उसका basically it is because of phosphodiesterase 5. ठीक है, 5 पे होता है side effect. excellent. action is this and this is your side effect. जो अदर ड्रग्स हैं tadalafil, vardenafil, उनमें दिस प्रॉब्लम इज नॉट देयर. दे आर लॉन्गर एक्टिंग ड्रग. इट इज वन ऑफ द शॉर्टेस्ट एक्टिंग ड्रग्स आल्सो sildenafil. ठीक है, जो लॉन्गर एक्टिंग are your tadalafil, which is 14 hours and this is just 4 hours action. Now let's get to the other drugs which are acting on the various phosphodiesterase enzyme. इधर ही कर लेते हैं. let's do phosphodiesterase 3 पे कौन सी ड्रग्स एक्ट करते हैं? Let's do here only. Phosphodiesterase 3. Best. It is contraindicated with nitrates. Absolutely correct, Rohit. Because they have a similar action. So therefore, they cannot be used. Both will cause increase in the cyclic GMP. Yeah, that is for, not for this. That is for tadalafil. Sildenafil is short acting, 4 hours. तो अगर आपको इसके साथ नाइट्रेट्स देने then 24 hours गैप देना पड़ता है. और अगर आपको tadalafil like ड्रग्स साथ नाइट्रेट्स देने पड़ेंगे then you can give after 3-4 days only, not before that. एप्लिरिनोन तो बेटा इट इज एल्डोस्टेरोन एंटागोनिस्ट. ठीक है, स्पाइरोलैक्टोन की जगह देते हैं, नॉट फॉस्फोडाइएस्ट्रेज एंजाइम. एप्लिरिनोन तो एल्डोस्टेरोन एंटागोनिस्ट है. फॉस्फोडाइएस्ट्रेज यू आर कंफ्यूजिंग. I think in the app, I haven't still recorded. I only have free classes yet on the app, so I have not the other classes. Meri nahi hai, so maybe that's why. I'm not sure. I need to try. Very good. It is milrinone. Yes. Don't confuse. Eplerinone is a aldosterone antagonist. Milrinone. ठीक है, milrinone. Very good. Amrinone, milrinone, और milrinone को what are these drugs called as inodilators. ठीक है, इनको कहते हैं inodilators because इनका inotropic effect भी है और vasodilatory effect भी है. They are used in CHF. These drugs are used in CHF. Phosphorus, yes, very good. Phosphodiesterase through rocmetroid is very excellent. ठीक है, roflumilast. And this drug is used in COPD. Roflumilast is used in COPD. Very good. Phosphodiesterase 5 हमने कर लिए. All these drugs जितने भी हैं fils, sildenafil, vardenafil, tadalafil, all these drugs are your phosphodiesterase 5 enzyme inhibitors. Then other drugs which includes the phosphodiesterase, not here specifically. अगर आप बात करें non-specific भी हैं. Theophylline. It is a non-specific phosphodiesterase inhibitor. Theophylline used in asthma, COPD. It's a non-specific phosphodiesterase inhibitor. Platelets में हम एक ड्रग यूज करते हैं एंटी प्लेटलेट ठीक है, डायपिरिडामोल. एंटी प्लेटलेट ड्रग है डायपिरिडामोल. इट कॉजेज इंक्रीज इन द साइक्लिक AMP levels. by inhibiting the enzyme phosphodiesterase in the platelets, and this leads to anti-aggregatory effect on the platelets. ठीक है? Then there is cilostazole. Cilostazole, ठीक है? Cilostazole, which is used in intermittent claudication, ठीक है? Because of the same effect, yes, right, yeah. ठीक है? So ये सारे phosphodiesterase enzymes है, inhibitors, like phosphodiesterase enzyme inhibitors, they are used. So last question for the day is drug of choice for chronic gout. Another very commonly asked question. Chronic gout. Drug of choice. 333, very good. All of you are absolutely correct. It is allopurinols. ठीक है? It is allopurinol, drug of choice for chronic gout. तो chronic gout के बारे में allopuria, all right. ठीक है? जितनी खाओ. So अब इसमें ये वाला जो important है, let's highlight this a little more and see. Xanthine oxidase inhibitors. So let's see. Acute is NSAIDs, yes. Acute. Aspirin. NSAIDs. Xanthine oxidase inhibitors. Let's do these drugs. Allopurinol. ठीक है? And febuxostat. ठीक है? So xanthine oxidase inhibitors is your allopurinol and febuxostat. Doesn't allow the hypoxanthine or to convert xanthine and xanthine to uric acid. So synthesis नहीं होने देगा. Synthesis inhibitors are your allopurinol, febuxostat, inhibiting the xanthine oxidase, causing the uric acid metabolism is uricase enzyme. Causing the uric acid metabolism is your uricase enzyme, और जो uricase enzyme को block करते हैं, these are drugs like ras buricase and pegloticase. ठीक है? ras buricase, pegloticase. These are the drugs which are blocking the uricase enzyme, and these drugs are your fastest acting drugs. ठीक है? So very good drugs for tumor lysis syndrome. Very good drug for tumor lysis syndrome, जहाँ पे the anti-tumor drugs हम जब दे रहे होते हैं, there is breaking of so many cells, normal cells, and they will lead to the uricase को block करना है ना बेटे का, so that uric acid uricase block नहीं करना, stimulate करना है, not block, stimulate, here please write it as stimulating. Thanks for correction. It is stimulating the uricase enzyme, so they are increasing the metabolism of uric acid to allantoin. ठीक है? So allantoin is more water soluble and can get easily excreted. So they are stimulating the uricase and increasing the formation of allantoin, water soluble है और निकल जाएगा बाहर easily. There's recombinant uricase enzyme. Excellent. So tumor lysis syndrome के लिए these are the drugs because they are very very fast, immediately metabolize कर देंगे. Third is your target is inhibition of the reabsorption of the uric acid by the uric acid transporter से they will inhibit the reabsorption. And what are the drugs acting at this level is your probenecid. ठीक है? probenecid हो गया. Very good. Then yes, it is for drug of choice. Actually allopurinol is there, but अगर fastest acting drug पूछी जाए out of both of them, then you should mark these drugs. Drug of choice is definitely allopurinol. ठीक है? And but fastest अगर they will ask you, then you should mark this group. They are faster than them. ठीक है? So lesinurad, sulfin, pyrazone, ठीक है, yes, and benzbromarone, ठीक है। ये आपकी जो ड्रग्स हैं, दीज आर यूरिकोसोरिक ड्रग्स। यूरिकोसोरिक ड्रग्स, दैट मीन्स दे विल decrease the reabsorption and increase the excretion of uric acid from your body. And out of this, benzbromin जो एक drug है, this is actually safer in renal failure. The other drugs are not safe in renal failure. Benzbromarone is safe in the renal failure, right? ठीक है। So ये थे हमारे कुछ important questions from the first 3 topics of pharmacology. And next session में we will go to the next different sections and we will discuss. So we'll try and finish in 5 classes, live classes, all the pharmacology, jitni bhi important questions that we can discuss from each and every section, right? Next class, I will let you know, it is next week definitely. Up I will, it's most either Friday or Saturday live class होगी, ठीक है, YouTube, so we'll let you know. Topics would be, अभी हमने किया है ANS general and autocoids. So next time, let me see, I think I've seen CVS, I'll be taking up I think CVS and blood, ठीक है, so CVS and blood, it would be there. Next class, ठीक है, next week is somewhere Friday or Saturday would be the YouTube class. And if you are on the app, अगर आप free live class is also going to be held this next week, and उसमें भी हम ये similar topics में more in-depth more questions are going to be discussed in that. That's in the free section. YouTube के लिए would be either Friday or Saturday. Next one. Is it worth to spend 2-10 hours video content of my come to party book explained in that course? Book, see, book का time, it depends. आप Shobhi, when are you exam going, or are you in like second prof and all, you still? Right. Shobhi, are you exam going? Second prof, okay, okay. Content on pharma, then you have to go through the book. There's no option. अगर आप book, there is no other way. Book makes your basics strong. ठीक है, MCQs is only later on. आजकल अब you will see अभी there is अब MCQs are going to be more clinical oriented and you need to work around कि क्या हो रहा है उस patient को, क्या नहीं है। तो MCQs अकेले MCQs sufficient नहीं होंगे आपको आगे. You have to read the party. There is no way anybody will tell you that skip the book and just go on MCQs. That is absolutely not the way to follow. आपने ये थोड़ी है कि ये जस्ट इट इज़ नॉट लाइक यूर डीलिंग विद ऐसे कोई पास कर लिया, इंग्लिश है, वो मैथ्स है, इट इज समथिंग यू आर गोइंग टू डील विद पेशेंट्स लेटर ऑन, ठीक है। सो आई थिंक इट्स देयर इज नो क्वेश्चन इन सेइंग कि मुझे अभी बेस नहीं बनेगा, बाद में कब बनेगा। बाद में यू विल देन स्ट्रगल कि मुझे ये समझ नहीं आ रहा कि ये ड्रग क्यों दी गई है इस पेशेंट में, इसको ये प्रॉब्लम थी। सो बेसिक्स बनाने के लिए सेकेंड प्रॉफ में यू विल हैव टू डू दिस, ठीक है। ये एमसीक्यू वगैरह लेटर ऑन आता है, बट पहले book reading. All right. Okay, everybody. It is 11:30 almost. So have a great अब तो evening है, सोने का time है. So please make sure that I hope you make जो भी most of these questions you would have discussed, you know everything beforehand only. But anything that you feel कि जो नहीं पता था, please add on to your notes. And these questions जितने भी हम discuss कर रहे हैं, मेक श्योर दैट इस टॉपिक को आप completely अच्छे से फॉलो करो एंड ग्रास्प द टॉपिक, बी अ मास्टर इन द टॉपिक्स इन दीज क्वेश्चंस. इट इज नॉट अबाउट द MCQ, it is about the topic asked in that. So next time they can ask you something different from the same topic. So ये topics हैं basically which you must know. All right. So chalo, let me end the class now. Take care everyone. See you next time. And I will definitely let you know. It is next week, for sure होगी class. And I think it's either on a Friday or a Saturday. YouTube is all either on a Friday or a Saturday. In-app में जो live class है, that will be somewhere maybe Wednesday most probably. So again, the similar topics में, but we go more in depth there and more questions over there. All right. Good night, everyone. Thank you. Stay safe and study best. Study all. What you can say? Study the best you can. So this is the time to study, right? Chalo. Take care. Bye, ma'am. Bye, bye. Bye.